Hey guys, it's Hina here at Rebalance Physical Therapy and Wellness, and today I want to talk to all of my moms who maybe recently had a vaginal delivery and you're feeling like, man, I wish I had an instruction manual on what to do after having a baby. I mean, we all know that, you have a child and you've got a lot of doctors and nurses around you that are taking care of your child, and they might be making sure everything, is okay in terms of your pain levels, but what is anybody doing in terms of your musculoskeletal health? How are you going to now get your body back together? And so, to me, I know after I had my delivery, I'm like, what? I need somebody to also take care of me because I just had some major trauma happen to my body. Pregnancy and delivery, it's no joke. I mean, you're carrying this beautiful child for 8 months, but man, is that baby changing your body. For many of us moms, I know this is how you're feeling because I hear it all the time from the own moms that I treat in our clinic, as well as what I've been through. You're having, everything from head and neck pain to upper back pain to mid back pain, maybe to pelvic pain, incontinence, maybe some heaviness in the vaginal area, something called prolapse. I mean, you name it. A lot of things can happen. But again, you get no instruction manual on what to do for your body. And, we can't assume that the body just automatically bounces back. And actually, it really doesn't. The body, every time you have a child, your body takes a toll. And it doesn't automatically bounce back without really good, specific rehabilitation and intervention for most moms. Now, I know there are some of you moms out there who, man, you don't have to do a thing and your body just comes back. But I would say for the majority of us that have had a child, I mean, you feel like it takes at least a year for your body to somewhat be back to normal. And even then, if we really, if you ended up coming to our clinic, we would find that, hey, there's definitely some deficits going on here. And sometimes the repercussions don't come right away. They come down the line. There are so many moms that I end up seeing where the problems actually occur weeks to months to sometimes even years later, and then they contribute it back to, hey, actually, you know what, this may have started after I had my child. And so, your body, you can't assume that it just bounces back automatically. It really doesn't. And so why believe me? Why, why is it that you should actually, listen to what I have to say? Well, my name's Hina. Some of you guys have probably been following me on YouTube, but I am a pelvic floor, manual, and orthopedic physical therapist, and that's a mouthful. But basically what that means is I have a certified background in treating a lot of orthopedic injuries, so meaning all the kind of joints in the body, as well as a manual therapy background where I really use my hands to really understand how everything from joints to muscles to what's called fascia feels like, and then basically how to treat it in the correct manner. But in addition, during all of these years, I've also been a pelvic floor therapist, and that is so important in really getting a good grip on how to really rehabilitate my moms. And then also from just personal experience. I mean, I've worked, number one, for so many years, but I've worked in some very prominent healthcare institutions as well as clinics. And I've treated thousands of patients at this point. And one of the biggest deficits that I see is that us moms do not have good guidance on what to do after you've had a child. And like I said, I've had 3 children myself, 2 vaginal deliveries, and a C-section. And each one of them had their own complications. And so my own journey is actually molded into this program that I have created. And, right after I had my child, you can see my body was just not looking like it normally does. This is months after having a baby. I still look pregnant. My posture is off. I was having a lot of upper back pain, a lot of neck pain. You can see my neck right here looks like it's just a divot. And man, I was having all sorts of aches and pains and problems, pelvic issues of my own. And, when I talked to my own physicians, they were like, well, you just had a baby. You just got to take it easy. How many of you moms have heard that? Take it easy. You just had a baby. Some of this should go away with time. And that's not necessarily, I would say, the best advice, because there are so many things that you can do from basically day one just to keep your body aligned properly, to improve your posture, to decrease stress on your joints. And then definitely as you get from, several weeks after having your baby, there's a lot of things that you can do to really get going and making sure that long-term issues don't start. So common questions that most of my moms have, and even that I had after having a baby, is, should I work on my scars? If any of you guys had perineal tears, vaginal tears, episiotomy, what about my scar? Do I need to do anything about it? Most physicians don't teach you what to do. Most nurse practitioners don't teach you what to do. How do I work on my scar? When is it okay for me to exercise? How much exercise is okay? And I've heard some nightmare stories about patients of mine, as well as other moms, that go back to doing way too much after having a baby, and they really put themselves in jeopardy. Could I make things worse if I do too much? Yes, you can, actually. What can I do for the constipation that I'm feeling? What is too much? Is it normal to have pain? When should I start feeling like myself again? When should I be concerned? What should I watch out for? Why am I having back and hip pain? Why is sex still painful? And is that okay? Is that normal? Why is my core so weak, and what do I do about it? So these are some of the common questions that I hear, but I don't hear that many healthcare providers are giving the right answers, or even giving any answers to this. Again, usually it's okay. It'll be okay with time. Give it some time. You just had a baby. And some of the more common problems that we see after a pregnancy and a vaginal delivery is everything from low back pain, tailbone, sacroiliac joint pain, and that pain is actually the pain that you have right in through here. Okay, it's this lower pelvic girdle pain, upper back pain, neck pain, scar issues and sensitivity, incontinence. Okay, so incontinence is basically where you pee with like coughing, sneezing. Sometimes you just got to find the bathroom right away, because otherwise you're going to have a big problem, big mess. Pain with intercourse, yes, that does happen after having a baby. Core weakness, that's a big one. Abdominal pain, bladder urgency frequency. Prolapses is where you start to feel heaviness in the vaginal and or rectal area, and it's actually descent or lowering of the organs into this area because it no longer has the integrity to hold itself up. And then a big one is also a diastasis recti, or sometimes people call it the mom pooch, or just a mom pooch. It's not always the diastasis, but a mom pooch, which is where you start getting separation of the abdominal muscles, and we'll talk about that in a little bit. And so low back pain is so common. 48 to 70%, I know that's a big range, of moms have low back pain during pregnancy. It's like a common thing. But guess what? 37% still ended up having pain 6 weeks after they have had the baby. And I will tell you, being an orthopedic therapist and treating spine for so many years, most of my women that end up coming in that have had a baby say their back pain actually started, and they never had any issues during pregnancy or right after pregnancy, and it never was the same. And also, pelvic girdle pain. What does that mean? It's basically pain anywhere along this pelvis. Okay, here's your spine. Here are your bones that are right below what some people say the love handles. Here's your pubic bone. Pain anywhere in this entire vicinity, including inside the pelvic floor, inside here, is considered pelvic girdle pain. And it does affect 1 in 5 women during pregnancy. Okay, and they continue to develop severe symptoms after having a baby for some. And what about pain with intercourse? Yes, I can tell you, for some moms, going back to wanting to have, or going back to intercourse, it feels awful. It feels burning, it feels achy. They have no idea what is going on. And for some, painful intercourse actually started after having a baby. So yes, this can be a problem. So we're going to tackle this and say, why is that happening? And of course, those vaginal tears. So pain with intercourse could come from vaginal tears, okay, scarring in this area. It can also come from other, aches and tears. So what I would like to point out here is that, even though you have a tear here, it can actually pull in any other areas of the body because you have tissue called fascia that actually kind of binds everything together. And it's kind of like this saran wrap. So when you have a scar right over here, it can actually be problematic for many other muscles inside the pelvic floor. So I'm going to show you this model up here. So even though your tear is out here, it can actually pull and tug like saran wrap and affect all of these other muscles in through here. Okay, and it can even pull other musculature, especially if you're still in pain and you're guarding. Say your scar didn't heal right and you had some complications, then it can actually cause other issues too, which we have seen in our clinic. And bladder frequency and urgency. For many of you moms, maybe you had no problems with your bladder, but leakage, feeling like you have to go to the bathroom all the time, feeling like you can't make it to the bathroom, that is not uncommon after having a vaginal delivery. And again, this can be caused by just the disturbance of everything from having a baby. It can be the muscles of the pelvic floor that are actually causing you problems. So these muscles here can actually contribute to bladder frequency urgency. Incontinence can come from, again, a couple of different things, but it can come from weakness of these muscles, but it can also come from a change in alignment of your pelvis. And most people don't know that. When your pelvic alignment actually changes, your bladder does not have as good a support, along with the changes in your posture. So changes in your posture, changes in how your core is functioning, including your pelvic floor, but also the change in alignment can affect incontinence. All right. Now, this mom pooch, one of the biggest things that I hear when moms are, talking to me, especially when they feel like their body hasn't gotten back to normal, is that they have this mom pooch. And what is the mom pooch? So, it can be everything from, yes, it can be adipose, okay? But it can actually also be a separation of the abdominal muscles. So there is something called a diastasis recti. Diastasis recti is actually where the abdominal muscles can actually separate, and you can actually see this separation happening in what's called the rectus abdominis muscles. So you can see here with my pointer that now the reason why I chose this photo is because you can see the rectus abdominis, which are your six-pack muscles right in through here. Now there is a line that goes through here called your linea alba. It's a tendon, all right, ligamentous tendon that actually goes right through the middle. And when that splits to accommodate the growing baby, so your body, your stomach, actually your abdominal muscles have to expand. So it is actually okay to have a diastasis as you are during your pregnancy where your belly is growing, okay? But for some, after having a baby, this does not automatically come back together. The ball doesn't bounce back in some women. And so you continue to see this separation. And for those that still have either a significant separation or have adipose, which is fat, on top, you can actually then, have the appearance of this. And with some of you moms that have less, you might actually be able to see this like this. Okay. The other noted thing is that some of you guys will start having this belly button kind of reverse inside out. This is called an umbilical hernia. It is very, very common with something called a diastasis recti. So most moms, what I hear is they don't even diagnose this issue on themselves like for weeks to months after they've had a baby, because they feel like, hey, shouldn't my body be back to the way that it was? And oftentimes, moms are the ones that are self-diagnosing themselves with this. Your healthcare providers aren't even telling you that this is what's going on. So with this program, what we do is we actually teach you from day one, hey, what is it that you need to start doing to make sure that you don't make this worse? Because this is not something you're necessarily going to be working on in the first couple of weeks right away. Because again, you're going to want your body to heal. But we do start teaching you, hey, at 6 weeks, this is what we want you to start testing. This is how we want you to start understanding how to self-examine yourself for a diastasis. And this is what you need to start doing in terms of starting to get your core to function well, but to make sure that you do not do the wrong exercises, because oftentimes I hear most women start getting back to doing higher level abdominal exercises, and they actually end up making this diastasis worse. So with this program, we make sure that you are doing all the safe exercises so that you do not make a diastasis worse, and that you start to improve on your core function in the correct steps that you should be doing this. All right? So just going back, most women do not know what the right exercises are to do after having a baby. And going back to these type of exercises for most women is not the right thing to do. And it can actually make incontinence worse. It can make low back pain worse. It can make your diastases worse. And it can make many other things worse. And so, like I said, maybe not all of you, but many of you are going to find that this is not the right things to do right after having a baby. Okay? So, I know it's frustrating because some of you are probably watching this video and you're thinking, man, I wish someone told me about this, because now it's been weeks or months and I'm still having this problem. Well, guess what? You can still start with this program because we teach you what are the right exercises for you to start right away and what to start doing so that you can start healing your body, okay? We teach you all of those things, all right? So going back to this core, why is it this core is so important, and what is this core? So for some reason, whenever I think your core is disrupted, I kind of think of the B-52 song, like, your core disrupted. And so I don't know why I think of that. That was kind of cheesy, but I just kind of put it in here because it just reminds me how pregnancy and delivery disrupts this core, okay? So there are 4 muscles that make up your core function, your inner core function, so should I say. It's the core that most people don't think about. Your diaphragm, your abdominal muscles, your pelvic floor, and your low back muscles. And I must add, this photo right in through here, this is actually from an amazing instructor. Her name is Diane Lee. She is an amazing Canadian manual physical therapist. And this is actually a photo from her Pelvic Girdle 5th edition book. So I want to make sure I give her credit for this, where she basically depicts this photo of what's called the abdominal canister. It's the diaphragm, it's the multifidi, it's these muscles right here. The multifidi are these deep low back muscles that you cannot see from the outside. The diaphragm, which is your breathing muscle. Yes, your breath. Your diaphragm is actually a core muscle. Your transverse abdominis, which is the deepest layer of abdominal muscles, and your pelvic floor is actually the muscles that are inside this pelvis. So those are these muscles right in through here. Now, those muscles, all of these, okay, make up your inner core function. And they're so important for the healing of your core. But for your outer core as well. So when you think of, hey, I want to go back to doing my Pilates, I want to go back to doing my crunches, I want to go back to doing all these high level exercises, getting this right and getting this improved is actually so important for everything from outer core function to also relieving low back pain, to reducing knee and hip pain, reducing upper back pain, improving your posture, improving your incontinence, you name it. This actually has to function well. And again, I want to give credit to Diane Lee. You're amazing, Diane. Thank you so much for allowing me to use this photo. But she's amazing, and she's another physical therapist that also believes that this core function is so important. But it is. This is all researched. All right. So basically what happens when that inner core function is not functioning right? Guess what? All the other muscles in your body will end up compensating in some way to actually help keep this inner core as good as it can be. So I'm going to go back to this photo. If there is problems in any of these 4 core muscles and they're not working in a harmonious fashion, then you're going to get a tug of war happening on the other muscles that attach to everything from shoulder to hip to pelvis to your knee. So when moms come in sometimes with their, saying like, hey, I started developing knee and I started developing hip pain after having a baby, guess what? We go back to looking at all of these muscles and making sure that they're functioning well before we even get to treating all the other muscles. So again, you're going to get compensations in all of these potential muscles that are in your body if that inner core is not functioning right. Okay, here is that diaphragm again. So sometimes, again, in this core, you can't see all the 4 muscles in through here, but you can see 2 of them. Here is the diaphragm. Here is the pelvic floor muscles. Now, you can't see those multifidi, the little low back muscles, and you can't see that transverse abdominis, but you can see all these other muscles. These are your hip flexors. Here are the buttock muscles right in through here. Here are your hamstrings. Here are your external, the outer core. This is your rectus abdominis muscles. This is that linea alba that I say splits with a diastasis, okay? Here are all the other muscles in your legs. When my moms come in, again, with hip problems, with knee problems, guess what? I'm going back to that core as part of their treatment to really make sure that all of this is functioning right, because without that inner core functioning right, you're going to have all these other muscles potentially compensating and creating pain. All right. And I just wanted to throw this picture out here too, because you can see here is the pelvic floor, but look at all these beautiful connections inside the body, all the way from your head and neck. You can see it's like one big continuous piece to the tailbone and the pelvic floor. And yes, this is all so important. Okay, when it comes to, like I said, simple changes in your posture will affect how your core, how your pelvic floor is functioning. All right, they're kind of like puppets on a string. If this is your pelvis, all right, so we're going to pretend like this puppet right here is the pelvis. Okay, you've got all these muscles, which are depicted by the strings here, that attach, including the pelvic floor, to this pelvis. And if this pelvis is not symmetrical, okay, this will contribute to changes in everything from bladder health, incontinence, prolapse, pelvic pain, any other orthopedics, aches and pains, and it can also change your posture, or your posture can actually change how your pelvis is functioning. So these muscles play a huge role, and you can see changes in this posture, all different sorts of different postures that you have will actually affect like I said, all of the things on the list, such as incontinence and pain and, prolapse and all this kind of stuff. It is so important that all of these things are tackled. So you see, there's a lot of things that you can do starting on day 1 after having your baby, which many practitioners do not tell you about. Okay, so again, all of those changes can lead to all sorts of aches and pains in your body, to incontinence, to just all the things that you think of, pain with intercourse. So what we tried to do is finally we thought, hey, we need to get this together for all of our moms out there. We need to give people a program, our moms a program, that starting day 1, we basically hold your hand so that we can help you improve that inner core function, which is so vital to making sure that the rest of your body is working well, and to prevent all of these downstream issues that can typically happen. And why our program? Like I said, now that you know a little bit more about my background and my experience with having my own children, this program is based on 20 years of experience. Not only my own experience, but of course my experience with other moms too, because I listen to them and I find out what are their frustrations, and what is it that even years later, what do they attribute their issues back to? And for many, it's after having children. Something fell apart, their body didn't get balanced, and now they're having problems down the line. And our expertise of helping 99% of our clients improve, especially our moms, thousands of moms treated at this point, from me as well as my colleagues. So this program is not just me. This is actually my amazing colleagues that actually work with me at our clinic too, who have, again, lots of experience too. So our program is intended to support what we do with our own clients, but also even if you as a mom are working with, say, a trainer, or you're working with another physical therapist, this is intended to support that, because we address the whole entire dynamic of this pelvis. okay, and getting that inner core functioning well. And of course, the greatest thing about this program is that we can support you through telehealth as well, should you need that. So as you go through this program, if you hit if you hit a wall, or you feel like you hit a bump in the road, then these are where we encourage our anyone who takes our program to email us questions, because what we tend to do is we tend to make another video to answer the questions that you might have as you're going through the program. And for those of you who live in Pennsylvania, we can actually do a thorough examination via telehealth and video for those of you who cannot come into our clinic specifically. And for those who we can't necessarily do like a specific evaluation because you don't live in Pennsylvania, we can have a case management consult where we might be able to help get you to the right resources, or if you hit a bump in the road, really guide you so that you understand what's going on and what additional things can help. And so what's in our program? Like I said, exactly, going from day 1 to 12 to basically day 1, and then every day telling you what you need to do up until 12 weeks post-delivery. And then currently we are actually developing the post-12 delivery week program so that you have continuity once you have gotten up to 12 weeks. Because really, by the time you hit 12 weeks, you should be able to get into higher level functioning. So this is where, like I said, we hold your hand, kind of like giving you that instruction manual of what you need to do to get that inner core, that diaphragm, that the pelvic floor, those transverse abdominals, and those low back muscles, how to get them functioning appropriately, and all the other muscles that attach around the pelvis, which is so important for stability and health, as well as everything from how do you get into your best posture? How do you sit correctly? How do you pick up your child correctly? So there's a lot of things, from even how to work on your scar. So let's go down this list because I kind of jumped off a little bit. But like I said, from day 1 until 12 weeks, we're going to hold your hand. How to effectively work on your scar from either the tearing or the episiotomy that you had. Postural education, how to sit, stand, lift without hurting yourself. Specific muscles to release and stretch, which tend to contribute to pain, and what we see in our clinic, what most moms have problems with. Your core function, which is so important. How, which, when, and why exercises that you should do. And how to do it so that you don't end up making things worse down the line. How to correctly and effectively perform a Kegel. Because I know a lot of you moms are like, well, what about the Kegel? Yes, how to perform a pelvic floor contraction correctly, and how to potentially use other tools and other products out there, such as vaginal weights. Do you use them? Should I use them? When is it good to use them? We're going to talk about that, and our products that we think are helpful and which products are helpful. And then a 20-minute stretch as well as a 30-minute exercise program to actually give you a good program to do so that you feel like now you're able to get exercise into your program. And the best part about it is that we basically have downloadable PDFs. It's 6 hours worth of education, guidance, instructional exercises, release, and routines. But like I said, the best thing about it is this is interactive. So you can write in emails, you can write in questions as you go through the program, so you do feel like somebody is there to answer your questions. And it's not just some program that you're going to buy and then that's it. There's no support. We have support for you. And in other ways, if you need more in-depth support, that is also available should you need it. And guess what? This program costs half the amount, less than what it does to see us for one in-person visit. But guess what? It packs a powerful program that really, this is going to help you get on the right track. So let's get started. Let's get your body rebalanced, because that is going to be so important for just your lifelong balance, and to prevent any other big things kind of popping up that you didn't expect, all because you didn't do the right things, that because you didn't have a manual. Guess what? You have the manual now. So let's get you started. So how do you get started? Okay, how do you get started to really enjoying your child and not leading of the frustrations of all this low back pain? Well, we get started right down here. All right, so depending on where you guys are watching, if you're watching this on YouTube, go in the description box down below. We have a link of what to get started. If you guys are on our website, again, you should have the link right below on how to get started. All right, so again, look downstairs, okay, in this website or on the YouTube video, or if you happen to find this, there should be information below on how to start with our program. And I'm going to see you on the other side to help you with your health and wellness. See you soon.